Nearly 50% of all heat stroke deaths occur in people over the age of 50. Older patients tend to sweat at a higher core temperature and have less sweat output per gland than younger adults. They also have an altered sensory output and ability to sense overheating. Alcohol and various medications such as barbiturates dilate peripheral blood vessels and interfere with the body's ability to conserve heat. Antibiotics, narcotics, anti-seizure medications, antihistamines, psychotropic drugs, anti-inflammatory, and thyroid medications all affect the heat-regulating mechanisms of the body.
Okay. What kind of medical problems does Vincent have?
Patients on beta blockers are prone to heat illnesses since they interfere with vasodilatation and reduce the ability of the heart to increase its rate in response to fluid volume loss. Intoxication with any substances can alter sensations and prolong a patient's reaction to temperature extremes. Though any person in poor general health is more susceptible to environmental emergencies. Risky conditions include diabetes, heart and thyroid disease, brain disorders, hypoglycemia, and sepsis. These and other pre-existing medical conditions can interfere with a patient's thermoregulation. Heat exhaustion is a relatively mild heat illness, although accompanying dehydration can have serious implications. Most often, heat exhaustion results from physical exertion in the heat without adequate fluid replacement. The body temperature usually remains normal or only slightly elevated. The signs and symptoms of heat exhaustion include headache, fatigue, dizziness, nausea, vomiting, and syncope.
Are you going to be able to get up onto the gurney here with a little help if I give you some help?
Heat stroke develops as a result of a complete failure of the body's thermoregulatory system. As the core body temperature rapidly increases, damage to cells and organs result. The patient's skin is usually hot, flushed, and dry. There will be an altered mental status, and the patients occasionally have seizures. Heat stroke patients can rapidly deteriorate into coma and even death. Classic heat stroke may develop over several days. Typically, the weather has high humidity in addition to the high temperature. Exertional heat stroke develops quickly. This is usually seen in young and healthy patients who were exposed to excessive ambient temperature. Physical exertion, poor or no hydration, or a lack of acclimatization are usually factors.